technician, so I was working in a supermarket and they needed extra help in the pharmacy. So I went in there and got a little bit of insight into pharmacy and found that I really enjoyed it. My mum worked in a hospital and said there was a job in the pharmacy, I should apply for it, so that's what I did, and that was as a pharmacy stores assistant. That gave me more insight into hospital pharmacy, and then I became a pharmacy assistant on the wards, which gave me more insight into what the technician's role was on a daily basis, which made me obviously then want to become a pharmacy technician. So then I did my technician course here, and now I've become a senior pharmacy technician in cancer services. Services as a pharmacy technician, so actually just being there at some of the patients' hardest times is probably the most rewarding thing, and knowing that I'm giving something to them as a patient, and knowing that, you know, I can make it that slightly little bit easier for them in such a hard time. Part of my job is to counsel patients on their new medications, so I think that's a big thing for the community, because then they know that they can rely on us if they've got any questions about their medications. I go through all their medications, make sure they know how they're taking them, when they're taking them, why they're taking them, which then obviously saves them having to ask anybody else. They've got the community here in the hospital to speak to us, and just, yeah, I suppose it helps in that way, because the patient then knows how to use their medication and it's safe, and yeah, I guess that's it really.